Atlas adjustment. These exercises help with neck pain in the cervical spine. There's always a lot of fuss made about the atlas. Let's have a closer look and find out where it is. Here we can see the cervical spine, and up on top of it there's the atlas and the axis joint it sits on, inside of which you'll find a lot of small muscles, most of which are way too tense, and where the fascia are also too clogged up and tight. And why is that? Because we're always slouching over our desks, on our bikes, and the entire force distribution in this neck area is totally out of whack. And these tensions are responsible for the vertebrae being warped out of their correct alignment, and everything gets jammed up. And you might think that's because the atlas is out of alignment, but fact is, it hurts because of too much tension. And from that follows that it makes no sense to press on the atlas, since it is only there because the muscles and fascia have pulled it there. And so, it makes so much more sense to relax this tension, and you'll notice how quickly everything back there is going to loosen up and realign. Ina, please take a seat. We're going to take a few minutes to do 2 short exercises. Let's start with an exercise that is always the most important one. Sit down and sit straight. Turn your head 45 degrees to the left. Use your left elbow to pull down your left shoulder with plenty of force. Reach with your right hand over your head and hold it. And then pull forward, diagonally downward, exactly like this. And you'll notice here in the back on the left side, a cord is being stretched really hard. By the way, we call this muscle cord migraine cord because this is where migraines start. And we are going to roll this cord flat in a minute. Pull more, increase your pull. Do this for 2 minutes, and during the 2-minute increase of the stretch, make sure to always stay under 10 on your personal pain scale. What does 10 mean? Our famous 10. It means that at 10 on your personal stretch pain scale, you can't breathe anymore, breathing stops, and you have to counteract, mentally or physically. That's something we don't want. This is why we say stay under 10. There has to be some noticeable pain, but not too much. But we have to go higher than 8. That means less than 10, but over 8. That's the magic rule, so to speak, for effective stretching of your muscles and fascia. And we need this time and the intensity. And if the pain subsides in between, increase the stretch again. And now we're going to work on the other side. First, your head goes back to the start position. Be relaxed. Make sure you're sitting straight with your upper spine straight too. Then you turn your head to the right. Bend your right arm again. Rule is, pull your shoulder in the direction your head is turned. People get confused, so that's a little rule to remember. Now reach with your left hand over your head and pull diagonally forward down to the left so that you could feel a stretch developing here on the right side of the neck. Here too for 2 minutes, and as soon as the stretch pain goes below 8 on your personal pain scale, you increase the stretch. Always careful, no jerky motions, and nothing bad can happen. And this is going to free up the upper layers so that the muscles and fascia underneath have at least a chance to move again. And after finishing both sides, each for 2 minutes, we go back into the starting position. Great. Now let's dive into the deep muscles. Where I said a minute ago, everything is attached, where the atlas is pulled out of alignment. And we're now loosening the tension that is pulling the atlas out of place. Now, bow your head. Keep your upper back straight. Grab your head with both hands. And now it's important to keep your back absolutely straight, so that only your head is moving downwards. And now, take your time, 3 minutes. Take 3 minutes. Keep on pulling downward. The biggest mistake here that also renders the stretch useless is rounding your back, bending your spine. You should sit straight as an arrow, like a board or a plank. Only your head is being pulled down. And after a while, you could feel a burn inside. Remember, under 10 on your personal pain scale, but over 8. And now you could reach those small muscles that are attached to the vertebrae, where the axis is attached to, and lean into it. And we have to do this for a little longer so the stretch can reach the deepest layers. And as soon as you feel the stretch, deep in there, no sudden movements, no jerky motions, just keep on pulling. Above 8, under 10 on your personal pain scale, and nothing can happen. Should you have had a spinal fusion operation? Do the same, maybe a little more carefully, but in principle, it's the same procedure. And when you're really deep in the stretch, then pull slightly, first to the left, and you'll notice deep inside. Now we are right at those very deep muscles and fascia here. Deep in there, there's tension on the right side and opens up a narrowed passage where the atlas is pulled out of alignment, where there's too much tension. Lean in as far as you can, and give it a minute on both sides, another minute. Same here. Smaller than 10 on the personal pain scale, but over 8. Move slowly. Always be more careful with your cervical spine than, let's say, with your knee or leg. And now back to straight. But stay in the stretch. Always make sure your upper body is straight. And now you pull your head to the right while your left shoulder stays down as before. And then you will feel a stretch on the left in the back and deep inside. And slowly, carefully increase the stretch. Always under 10, but more than 8 on your personal pain scale. In case you can't manage pulling with your left arm and keeping your shoulder down at the same time, just take your right hand and pull your left shoulder down, the way we did before, and then pull your head to the right. That's just an alternative in case your shoulder tends to go up. Lean into it. Also for 2 minutes. Let's say 1 minute for each side. We had 3 minutes for the deeper muscles, then 1 minute this way, 1 the other, for 5 minutes total. And then go back to the center. And when you're there, lean in a bit more. For a few more seconds, you'll notice you can't go deeper anyway, at least not during an exercise. Everything opens up back here. Leave your back straight, and then slowly move up. Slowly move up again. Go back into your normal position. And feeling okay? Let's do the counter movement. That means sit straight. Now, imagine this. Let me show you here. Now, imagine that here, north of your shoulder level, your cervical spine is tilted back straight. It's hard to picture, I know, but you'll understand in a minute. And the moment your entire cervical spine can't go back any further, you, from bottom to top, try and bend back even further. This is to give you a visual ID. Please turn to the left so people can see better. Now, keep your head straight. Put your left hand on your forehead. And now, visualize how you are tilting your cervical spine back. Push your cervical spine back, and you'll notice it is barely possible. And you notice that your cervical spine can't go back any further. Then you start to overstretch at the lower section. Not your head just yet, only in this lower area. A bit more, a bit more. And then you work your way up on your cervical spine till you reach the top. And then you open your head. Open it. And now we're going to loosen the tension in the front, because that's the reason why everything is so tensed up. This always going back and forth situation. Very good. Then lean into this stretch and overstretch. Work on it. Okay. Do this for 2 minutes. Move slowly. And this might be quite painful, but still, under 10 on your personal pain scale. Just release the stretch till it is bearable again, and then go back at it. Always under 10. If it doesn't go back to under 10 and stays there, move forward again, away from this threshold so you don't put too much strain on your tissue. Then slowly come back up again. Great. And now, we have moved a lot of things up there. Please, Ina, turn and face the camera. Take your medi roller first, with the grooves in the middle for your spine. Should you not yet have this roller, please take something round and wrap something around the two ends, leaving some space in the middle. And now you start under your ponytail at the end of your upper skull, where your skull ends. You could feel this little bump there. Place the roller on this spot and roll down with pressure. Hold the roller at the middle section. Can you do that? And then roll down. You can go faster for this demonstration, but you should always roll down slowly so that all the waist there is starting to move. And we have to move slowly so that the fibroblasts get their marching order to unclog the fascia. At the same time, the blood flow increases and everything relaxes. Everything goes back to normal. You could do the roller massage before or after the exercise. There are pros and cons with either method. Okay, go down as far as you can. And then we switch. Let me take this. And take the mini roller. It is harder than the medi roller. If you don't have one, take a roller of the same size and diameter that is rather hard, because we're going to work on these lateral cords. These are the ones we were talking about at the beginning. And you can go back into the same position, head 45 degrees to the left, and bend forward. Now take the roller with both hands. Turn your chair like this. It's better for the camera. And viewed from above, the angle is approximately 45 degrees, not from the front or the back, but relative to the middle. And then you roll out this cord. Press really hard. Move down slowly. Faster for the purpose of this demonstration. You can repeat it more slowly at home. Exactly, all the way down. And at a certain point, you can't hold the roller anymore, and then it's time to switch sides. Let's turn the chair again. And now you turn your head to the right, 45 degrees. Ina, please take the roller. So you can watch Ina do the exercise. And behind the ear, there's a bone called the mastoid sticking out, and that's where you start. And then with a lot of pressure, roll here into this side. Go all the way down. Go slower when you do it at home, slower than Ina is showing you. That's exactly the right angle. And then you'll notice you've reached the end because it's awkward with your hands and gets difficult to handle. Then slowly go back, face to the camera again. So now we've opened up everything back there pretty well, got the blood flowing better. And that should adjust the atlas. Maybe not right away, but we've reduced the tension that pulls the atlas out of alignment. And now it will self-regulate. And what's left to do now is turn your head forward, backwards, to the left, the right, bend sideways, left and right, get everything moving. Do the exercise regularly. The best would be 6 times per week, at least at the beginning. I hope you've liked our exercise. We're always happy about a thumbs up, like and share our video. People have to know about this, how they can get rid of the pain, how they can help their body to realign its bones so they feel comfortable. Bye and see you soon.
Tschüss.